Okay. So I just want to welcome everybody here today. This is the second series of classes that we've done. So what we're going to do over the next 4 weeks together is just we're going to take a journey a little bit through chronic pain. What is chronic pain? What are the different things that affect pain? And also what we can do to make our lives a little bit easier. So this is, we're here on behalf of the Bill Nelems Pain and Research Center. And Dr. Nelems, who some of you may have known, was a thoracic surgeon, and chronic pain was really, this group, in fact, was really his baby, was his passion. So I'm very honored to be here to carry on what he already started. So it's a group about pain education. And what we've named this group is a 1-degree course correction, just meaning that we can change the path that we take 1 degree at a time. So we're not looking for huge, leaps and bounds and changes today when you leave here, but as in anything, very small changes consistently over a long period of time are going to take you in a different direction. So I'm Madeleine Eames, and right here is Ellen McNaughton. 2-minute break. Well, that was fast. Okay. So 1-degree course correction, and you can see on the map here that from the very beginning, you can make little changes that lead you to a very different destination over time. So we're not just thinking about today, we're thinking about what small change can I make, what would that look like a week from now? What small habit can I change every day, what would that look like a month from now or a year from now? And we know that's where real change and shifts happen. So if you are here today, you may have been on this journey for quite some time. And you may be here with some hope or expectation, anticipation, or you may be here feeling very discouraged, frustrated, and alone. You may be here with a loved one or a friend, and you may have seen them suffer over a period of time with pain. So I just want to say welcome, and we're glad that you're here today. I want to acknowledge Dr. Paul Etheridge, and he's here with us today to say a couple of words. So I'll call him up. But just before that, the hour and a half really is about you being comfortable. So if you do need to get up or move around or stand, washrooms are down around the corner here or up and where you came past, where you came in outside. If you need to get some water, please just do what you need to do to make yourself as comfortable as possible.
Okay, does this mic work? That's good.
Yes.
So thank you for taking the time to attend these 4 sessions this month. The pain management groups really, from our pain clinic point of view, is so important for patients. It's a real important part of self-management. As doctors at the clinic, we're pretty good at evaluating patients to find pain generators and treating them if there's a treatable cause. But yes, you can't hear? I'll bend. As doctors at the pain clinic, we're pretty good at managing chronic pain from a pain generator point of view. But as we know, chronic pain actually is not a constant for most patients, but they tend to come in waves. And there will be times between visits at the pain clinic, which is usually 2 to 3 months, that you'll get some of those really bad pain waves. And the pain management groups is a good place to learn some tools to be able to manage those waves better on your own. So we want to give patients a bit of power back to actually manage pain on their own, not necessarily just with drugs or with injections, but on a day-to-day basis, that you can actually take some control back of that. So a lot of these sessions will be to equip you to manage your own pain better. The other thing that this group is good for is to be able to look at your own thinking and your own emotions and how that plays into how you experience pain. And when I talk to my patients about chronic pain, I usually explain the global pain or the total pain phenomena. And what that means is I'll have a patient come in and I ask them, what is your pain on a scale from 0 to 10? And some of them will go 15. I go, well, that's over 10. What do you mean? Well, no, for me, it's way more than 10. And the reason why that is because we have two different parts in pain that we experience. We have a physical component, and that's when you jab your finger on a hot plate. You feel that quick jab of pain. It makes you pull it away. So that's the physical component of nerve endings in your body sending signals to your brain saying there's pain, watch out, be careful, back off. But with that, there's always going to be an emotional response. So when you do that, the first thing that comes to mind is not, oh, there's pain. It's usually, oh, there's pain, and maybe a swear word slips out or a tear runs down your eye, and that's the emotional response that you have to chronic pain. So what Mary Ellen's going to talk about in some of these sessions is how we can evaluate our own thought pattern to realize that the way we think can actually influence the way we experience pain, the unpleasantness of the pain, the injustice of it, and how we can actually manage that. And by managing that, you can actually control your pain better. So I think these sessions are more than just a last-ditch effort. I think it's a very much important part of our multi-modal pain treatment. We can't just give pills or do injections and think you're going to actually have a good outcome in the long run. We have to give you guys some tools to manage this better. Okay? Over to you.
Thank you. Thanks, Dr. Etheridge.
So I'm going to be around, and we're going to have some question and answer sessions. The questions are really difficult, I may not be able to answer.
Great. So, how do you manage pain in between doctor's appointments or healthcare professional appointments? And we know that patients who get involved in their care, in managing and even sometimes leading their health care, actually do better in the long run. So these are some of the people that you may know from being around the clinic. Just a big thank you to Coniger and all the administrative staff who helped to set this up and to keep the clinic going. And the faces that we've had come in and talk during this group, some of the doctors and other staff that are at the pain clinic. And what this course is based on, mostly, is something called the Pain Toolbox. Treatment options for pain beyond medications, surgery, and injections. And these three people here, Pam Squires, Owen Williamson, and Neil Pearson, who is in Penticton, developed this pain toolbox, so other ways of being able to manage pain. So you probably can't read that from there. By the way, all these slides are going to be available, I believe, on the clinic website. So, don't worry too much about having to take notes if you've forgotten something or you don't catch it. To make it look a little bit easier, these are the different tools that we're going to run through in the 4 weeks. So first of all, we're going to start with knowledge about pain, which is a really crucial part of the process. This is not, I think, something that was taught in medical school like 10 years ago. And most of the advances in chronic pain have come in knowing about what happens in the body in recent years. So it's important that you know what's happening. Optimizing sleep, lifestyle changes, just going around, gathering support, the right kind of support that's helpful. Mindfulness, you may have heard of. Yoga benefits a lot of people, and breathing is going to be key. Gentle exercise, so getting moving safely again, which is really the goal of how do I move easier in my life now. And the green one, CBT. Anybody heard of CBT? Yes? Anybody want to take a shot at what it stands for? Cognitive behavioral therapy, yeah. And which was kind of the gold standard for therapy in the past. It's shifted and changed it a little bit. It's about really how thoughts and emotions affect us physically. So making that mind-body connection. Just briefly today, introduction, pain information, a little bit of talk about grief. Next week, we're going to go more into the difficult emotions that rise naturally, getting support and breathing. And if you just notice, are you breathing right now? If not, maybe just take a little bit of a deeper breath. Week 3, sleep, lifestyle changes and movement, and week 4, CBT, mindfulness and relaxation. So all the tools we're going to cover, and you're going to pick and choose what is going to work for you, which is probably going to be very different than the person sitting next to you.
Recognizing that one of the things there's going to be a lot of repetition in this course, and what we're going to really emphasize is that we're not asking you to throw everything out that you're doing now, whatever you're doing. We're going to say maybe there's something else, one little thing that we might be able to offer you that might help. And so if you can look at it that way as a 1-degree course correction. Oops, wrong way, sorry.
I'm doing the same thing. Okay, so just give feedback if it's too loud or if you can't hear me. So if you are here today, you may have been on this journey for some time now. You may have already tried numerous ways of helping your pain through medication or surgery, injections, or other strategies along the way, some of which may have been very helpful and perhaps others not so helpful. Or you may be new to the experience of pain in the last year or so. But either way, I'm really glad that you're here. And some people may be arriving feeling discouraged or frustrated, or feeling alone or misunderstood, which is a common experience with chronic pain. On the other hand, you might be feeling hopeful and anticipating perhaps picking up some new information or a new habit or a new tool that you might be able to implement in your own life. So when we say a 1-degree course correction, just a couple of things. We're thinking about, as Mary Ellen said, small changes that can be implemented, not just perhaps today, but what would that look like? A small habit or a small change consistently over the next week? And what would that look like over the next month? And what would that look like over the next year? Assuming that it's helpful. Don't keep doing something that's not helpful, obviously. So just to keep that in your mind. And the one thing that we ask you is when you look at the course and the change in trajectory, to, as best you can, stay the course. So you might try something and it's not really working for you today, or maybe tomorrow you try again and it works a little bit better for you, or you feel better. And what might work today might not be as helpful a month from now. So really staying open to possibilities and also staying the course. So we have a lot of information to give to you, and your experience and what works for you might be very different than the person next to you. You might also be a supporter or a caregiver and have watched your friend or your loved one struggle over the last year or so or more. And so I just really welcome the supporters here today as well. A couple things. Washrooms are either out this door around the corner or up and down the stairs to the left. And the other thing is that we're here for an hour and a half. We're going to take frequent short breaks just to get up, stretch, move around. but I really want you to make yourself comfortable. So if you need to get up, if you need to move, if you need to walk, please do. The more you can, the more comfortable and included you can feel in this class. We will, there will be questions that come up. If you have burning questions, feel free to ask them, but we will have a period at the end where you'll have an opportunity to ask questions. So yeah, I hate having to stay in one spot here, but anyway, here we are. Good.
Okay, so the first thing we'd like to do is to thank and acknowledge Dr. Paul Etheridge, who runs the clinic and who has really gone above and beyond to facilitate and make this course happen. So I really feel grateful to him. We also have some support people. Conager is in the back. You probably talked to him. We have Colby sitting in the back here as well, and these people absolutely make this course happen as well. So Conager, if you want to give us a wave, that's the two people that are very, very supportive of this course. And people that I think if you do have questions also, you can maybe ask them and they'll be happy to help you. These are people that you probably will see around the Pain Clinic, and hopefully these people will be popping in over time over some of the different courses that we're going to be doing. So again, one of the things that I love to think about is the whole concept of interdisciplinary, and to see how different ways of going at facilitating the treatment of pain can be helpful. And so I think this is exactly what we're hoping to achieve here, is to have an integration between medical, emotional, and educational kind of support for pain. So
we're going to be following something called the Pain Toolbox, which is actually a very useful resource. It's on the Pain BC website. We just want to acknowledge Dr. Pam Squire and Owen Williamson on the left-hand side for you, as well as Neil Pearson, who is from Penticton, a physiotherapist, and his website, if you're interested in more resources, is lifeisnow.com, and is also a very, very helpful resource for people with in persistent pain. Okay. So this is an outline of their toolbox, and it just gives us a framework for what we are going to attempt to be covering in the next 4 weeks.
Okay. So we just wanted to simplify it a little bit, just to give you a sense of the focus of what we're going to be talking about in the next 4 weeks. We're going to talk about knowledge about pain itself, what pain is and what the difference is between acute pain and chronic pain, because that's really helpful information to understand. We're going to talk about optimizing sleep, because sleep is really, really important in the whole. You'll notice that all of these things interact with each other. So when there's a positive shift in one thing, it can actually facilitate a positive shift in all of the other things. And unfortunately, the same is true in a negative way. For me, my focus is going to be CBT, which means cognitive behavioral therapy. That's one thing where you talk about how what you think affects how you feel and how you experience your life. I have sort of a somewhat a unique take on cognitive behavioral therapy, and we'll talk about that. The other thing that my focus is going to be on is gathering support and communication. And so we're going to talk about what that means to be able to make requests around things that really are supportive, and be able to, when you think about communication, we often think about communication between people, but we're going to be looking at what the communication is like in your own head, what kinds of things you're saying to yourself, and are you really supporting yourself, and looking at ways to be able to be really more supportive in your own life. And basically, I'll let Melanie talk about mindfulness. We're going to talk about breathing and lifestyle changes.
Mm-hmm. So when you see all these circles up there, you might think that's a lot, but in my experience, the more we can look at all the different factors that affect our experience of pain, it gives us more opportunity to go in like a doorway or to make a shift or a change. So here we have, 7 ways of possibly being able to make that 1-degree course correction. So my experience is more in the areas of, I teach yoga for chronic pain, and also breathing and the importance of breathing to calm our central nervous system, which is revved up in a response to being in chronic pain. As well as gentle exercise and lifestyle changes.
So basically, this is what the 4 weeks are going to look like. Today we're going to do this introduction that we've just done. Madeleine's going to give you some information on pain, and then I'm going to talk to you about grief and mourning. I'm actually a bereavement counselor. So that's one of the things that I do in my counseling practice. But grief is something that is very prevalent with chronic pain, so we're going to talk about that. Next week, we'll talk about difficult emotions and basically communication and how to communicate to get the kind of support that you want from your support system and the people around you. And again, we'll keep coming back to the breath, because breathing and the breath really is going to be a central kind of focus. On week 3, we're going to talk about sleep and other lifestyle changes, and also connecting to getting movement happening again. And the 4th week, we'll come back to cognitive behavioral therapy again, mindfulness, and talk a bit about relaxation. So that gives you a bit of a roadmap of where we're going to be going in the next 4 weeks. Something I just want to, again, just reiterate, I know we've already said it, it can be overwhelming, it can seem overwhelming, there's just so much information out there. People are always going to tell you, this is the answer, this is what worked for me, you have to try it. We're never going to tell you that you have to try anything. We're always going to invite you. We're going to present, there's a lot of information, there's a lot of new information out there. But what we're always going to keep coming back to is for you to trust yourself, because you actually do know what resonates for you. If something resonates, then try it. If it doesn't, leave it at the door. We have no particular attachment to any particular thing that we're presenting. We just want to present a lot of information that's out there, and a lot of it that can be very helpful. But the main focus is for you to trust yourself.
So the way we've designed it is an educational course, not so much counseling or therapy. You may have a lot of questions about your individual situation, either medically or or emotionally. It's hard for us to meet your need or answer those questions, because clearly we don't know the whole context or the whole picture. So it's information, understanding, and some tools that hopefully you'll take away with you. I think you said the rest there. Yeah.
And now we're going to have a 2-minute break. So you can stand up, walk around, and we'll be back in 2 minutes.
Not used to these like really short breaks, but anyway. Okay, so where do we start? We start right here and now in this moment, with wherever you each individually are at. And anytime if you start to at all feel overwhelmed, just chronic pain itself, as we know, is an overwhelming experience, come back to where do I start? Right here. So every journey starts with a single step, and that one step may do for now. I want to talk a little bit about the pain spiral, and that might not be so clear for you. So you may find yourself somewhere on this spiral. And just another example of how everything kind of fits together and almost has like a domino effect on the next step. So for example, often when we have pain, we have anxiety. So the pain and anxiety can make it very difficult to sleep. And then lack of sleep makes the pain worse and decreases your energy. Chronic pain affects our mood, our emotions, and can lead to depression, anger, and anxiety, and we're going to get into more of that next week. But these feelings actually make coping with pain even more difficult. And then the activity level, with a lack of sleep and energy, makes it hard to stay active. And we know that one of the biggest side effects of pain is then reducing your activity or your movement level, which affects other systems of your body. And then energy, so coping with pain obviously drains energy. So this might seem, again, like bad news, or it may seem like this is not new to you, but it also demonstrates that if we can change one of those, tweak one of those areas in one small way, it is like a domino effect. For example, I'm just thinking about somebody I knew once that drank too much caffeine. So the caffeine gave her anxiety, and the anxiety prevented a good night's sleep. And then without a good night's sleep, affected her mood and her activity level. And then it just went around in a spiral. And when we figured out that one keystone habit, when she reduced and eventually eliminated caffeine, a lot of the other things came into, were helped as well. Okay, so knowledge and education versus the therapy. So first, let's do this. A little bit about pain. So we're going to talk a little bit about two different types of pain: acute pain versus chronic pain. So does anybody want to take a stab at what is acute pain? Anybody want to take a stab at it? What is pain?
I got chronic pain.
You've got chronic pain, yeah. I cut my finger and it hurts. Is that what you said? Yeah. Yeah, so acute pain would be the pain that we need in response to an injury or an illness or circumstances of potential or real danger that send a message and alert us of potential harm. And so what happens after you cut your finger, you put a Band-Aid on it, what usually tends to happen?
I got a vertebrae that's out of place.
Okay.
And nothing they can do about it.
Yeah.
They're afraid to operate.
Yeah.
Because if they hit the wrong nerve,
right.
I'll be paralyzed.
So we're going to get to chronic pain, and we're going to get to what you are talking about, chronic pain. That's going to be the main part of our talk. So we're going to get to that. Hold on to that. So acute pain is what happens in response as to, say, burning your finger on a stove or cutting your finger, and it usually clears up after the injury is healed, sometimes a little bit after that or even before, right? So what would be the purpose of acute pain? There's a reason why I'm telling you this. Yes?
It tells you to stop doing what you're doing,
Exactly.
like a warning signal that you're in danger.
Perfect, yeah, absolutely. Protection, a warning signal that you're in danger. So we need pain to be an unpleasant experience. So when if you cut your finger with a sharp knife, we need our body, we need that signal to tell us that this is dangerous, or we'd be cutting our fingers all the time. Or approaching a hot stove. The moment you put your finger on a hot stove, it's going to hopefully send you a very quick message. Because if we didn't have that message, we might not be inclined to move our finger, and then we're going to end up getting burned. So to prevent us from having potential danger. So the purpose of pain, it's evolved as an alarm. It's an alarm system to protect you or alert you that something is wrong so that you can change your behavior, move away, or rest so that you can heal. So we need acute pain to tell us when we're in danger so we can survive. So without acute pain, we probably wouldn't have survived, because it's kept us aware of any potential dangers. We wouldn't be here. So there we are, learning very quickly at a young age. You only really have to, because our nervous systems are so good at remembering, how many times do you think you need to touch a hot stove? Not very many. Once should do it, hopefully, if we're paying attention and we've got a good alarm system going on. So pain is here to protect you. You sprain your ankle, ouch, automatically protection options. Should I lie down, lift my foot, get to some kind of safety? Okay, so I'm just going to move into what actually happens when you have pain. So the danger messages or the danger detectors that are, say, picked up in your finger when you touch a hot stove or you cut your finger with a knife are instantly translated through and modified, hit the spinal cord, up the spinal cord as they travel up to your brain, all within a split second, right? Even not even a split second. And in the brain, the brain decides, taking into account all the information available, how dangerous is this? And instantly sends a message back down to either increase or decrease pain protection. Okay? So we have the other messages can also increase or decrease the intensity of the danger messages sent up and down the pathway. So as I just, this morning, no word of a lie, as I was walking my dog and just thinking about pain and examples of pain, I actually slipped on the ice and fell on my knee, and I thought, okay, well, there's an example right there. So because where I live, we still have ice. And so instantly, a pain from my knee. I had a good example of the message traveling up my spinal cord into my brain. My brain instantly evaluates, how dangerous is this? So as I look around, I see I'm okay. I can feel the pain, it starts to subside, feels all right. My brain sends a message back down. I'm not in danger. I can pick myself up and I can keep on walking. And luckily, the pain subsided. But if I was to look around and know that, oh, I've hurt my knee before and it really, really hurt last time and it's hurting this time, that I'm getting a message that perhaps this is more dangerous than I think it is, and I hobble home, I'm going to have more pain messages sent back down to the site of the injury. So it's a very quick process. So just really quickly, you have the injury, the danger detectors send the message through a complicated process up the spinal cord, and the brain evaluates, is this dangerous or not so dangerous? And then we have the thoughts and the emotions and assessment of potential threats that can either modify or decrease the pain messages or increase. And then we go into protection mode. So the pain could be pain, muscle spasms, weakened muscles. Hormones are released, stress hormones, and we move into a fight or flight response to protect ourselves. We get it. This, if it sounds complicated, we're going to go over this in different ways throughout the 4 weeks. There's no test at the end. Okay. So, for example, this fellow has noticed he's got a splinter in his finger. And those splinters can really hurt. But when he sees it and evaluates it, it's just a splinter, his brain will probably evaluate that this is not so dangerous, and the pain messages will probably start to decrease. Now, I'm just going to put it out there. What do you think would happen to this fellow if he played guitar for a living, and he had a concert that night that he was going to have to play at, and he realized he couldn't play his guitar, and his income depended on that concert that night. There's no special answer. So I just want you to think about that. If the threat seems bigger to him personally, the pain, the level of pain could increase. Because that's a lot of stress to think about that as well. Okay. So hold on to that.
I can add.
Yeah.
A thought that comes to mind too, just hearing you say that, Madeleine, sometimes it's not something you can see, not a little thing. Say, for example, you fall and you hurt something inside and you don't know. You don't know if it's danger or not. So you come to a physician and say, I have pain, and maybe it's horrible pain because you really don't know. And the physician, you know, you do tests and oh, you know what, this is what happened and it's fine. So sometimes it's just, it can seem like something that it could be dangerous, but we don't know if it's a lot of the reasons that we come to the kind of places we are here is to find out, is there something I should worry about? Or, you know, is it something that I can relax and allow those signals from the brain to come down and say, no, it's not dangerous? Because it is a fine balance. Sometimes we don't know if it's dangerous or not. Right?
Yeah, absolutely. Yeah, which can create a lot of anxiety with the unknown. So what else can possibly, we have these physiological responses going on in our body. What else can possibly affect our pain? Is there anything that jumps to mind for you? You probably have noticed already in your life, you're here, you already have strategies of what helps and what doesn't help your particular pain level. Stress. Has anybody else noticed that stress increases pain levels? Yeah. So stress is a big one. The meaning you give it, I'm just going to give you some off-the-wall examples. Childbirth, if we know that's very painful, but we know that there's a reason, a beginning, a middle hopefully, and an end to it. So there's a sense of control. The other example that I've seen given is walking on hot coals. Now, I don't recommend that you go home and try this, but in some cultures, it is a rite of passage to do an extremely painful process with somehow very little pain. So I'm just giving you an idea of how we interpret, or how our brains interpret pain can affect the level of pain. What you see, if you've ever had a cut and doesn't feel like very much at all, and then you look, and I had this happen to my little boy the other day, looked and there was a whole pile of blood, all of a sudden it became very painful. And it really did, because this pain levels increase. Or if you happen to fall and actually see a bone sticking out, your pain levels are going to, because you've assessed it as far more dangerous than you thought, are going to increase. What you say to yourself, your thoughts, and we'll be getting into that a little bit more. And by the way, these are all very automatic processes that happen on all pretty much on their own. And memory. So it just reminds me again of a client that I had that suffered very severe injuries in a car accident that were very intensely painful. And we kind of got her pain down to a manageable level, but every time she drove down the Trans-Canada Highway past the site of the accident where it happened, what do you kind of predict would happen? Her pain levels would increase. Yeah, and it just makes sense. And emotions. Emotions are a natural response to pain, difficult emotions. But if we can learn to work with them a little bit better, we might find that it affects our pain levels. So, but basically, everything affects our perception of pain. And also, we can use all those ways of being able to cope, manage, or decrease our pain. So, all right. So, chronic pain. So chronic pain affects 1 in 5 Canadians now. So that's quite a significant portion of the population. So if, as I said in the beginning, if you do feel alone, as you can see, you are definitely not alone. So if your pain has persisted for more than 3 to 6 months, we call it chronic pain. Chronic pain is complex. I don't even know if we completely understand the processes behind chronic pain, but the advances are in medicine are just increasing all the time. It's invisible and confusing, but of course it's very real. And it's like a fingerprint. Everyone's experience in this room is going to be a little bit different. Okay. So with chronic pain, and so you know, my portion is almost done here, bear with me. Sometimes the nerves, or the neurons, as I talked about, the danger detectors that get excited when you experience pain or potential or real danger. Sometimes they stay excited or protecting long after the injury, illness, or the condition has healed. So you may have had the experience of somebody telling you there's no identifiable cause for this pain that you're experiencing, which may in fact be true, that the cause could be healed for some people, but the pain continues on. So why is that? So our central nervous system is really good at learning and will do anything to protect you. So it has learned super well, how to protect you, and becomes sensitized to any input, even if it's not dangerous anymore. So when I say sensitized, an example would be if you suffer with fibromyalgia, for some people, a very light touch that would be perceived as a light touch to other people can be perceived as extremely painful. So that it's true for some people, right? Yeah. So it's your nervous system has become sensitized and gets really used to alerting you to danger. When there's no danger, this is not dangerous. Right? So the gates that close, so when we talked about an injury healing and pain subsiding, in acute pain, those gates of pain close, okay? Because it's no longer needed. I'm okay now. But sometimes the gates that close when an injury is healed can continue to remain open. So those pain messages continue, and the chemicals, stress hormones continue to flow even though there's no danger anymore. Okay. So you might want to give some thought, and there is a worksheet that we've given out in the beginning, to notice for you already know, some triggers of what opens and closes, and what closes your own gates of pain. Blank slide. Okay. So every system of your body changes when you need to be protected. And has anybody heard of the fight, flight, and freeze response that I referred to earlier? So the fight or flight is the fight, flight, and freeze response turns on when your brain decides to evaluate that it's dangerous to feel pain and to feel pain. So the fight, flight, freeze response is the response in our body. For example, if a grizzly bear walked in the room right now and was looking for supper, probably all of us would instantly, our flight, freeze would turn on. And that gets our body ready for action, for protection. So we're either going to flight out this door, or we're going to fight, or we're going to lay down and freeze in an effort to stay alive. So when that happens, all your system of your body gets involved. So your mouth tends to go dry, all your muscles engage, your muscles get tense, your digestive system tends to stop because you don't have time to digest at a time like that. So that's what we're talking about with a fight, flight, freeze. And eventually, your central, don't worry if this feels overwhelming or too much, as I said, there's no test at the end. And we're going to say it in different ways throughout the 4 weeks. Your central nervous system learns very well how to protect you, so fight or flight, even in the absence of an injury. Okay. So you may notice already what other systems of your body are affected when you experience pain. So in response, tense muscles, upset stomach, anxiety in response to chronic pain. So pain can be deceptive. And what I mean by that is, well, this grizzly bear looks pretty harmless right now, but we can see that when he wakes up, it could hurt very much with nails with claws like that. Pain can be, stay with me here. So the amount of pain doesn't always equal the injury. As in the case of a paper cut, we know that small injuries can create a lot of pain. And we also know, have had the experience of people suffering tremendous injuries, and what you would predict would be very high levels of pain, experiencing very little pain. So it's not always an accurate indicator of tissue damage. So pain can show up in different places. Has anybody here ever had a brain freeze? Yeah. So we know that there's no injury in the forehead, right, when we eat an ice cream, right? But the pain is showing up in an area where there isn't an injury in this case. But no matter what, pain is real. It is your experience, and it is the experience that you say it is. That's my definition of pain. Phantom limb pain, people who no longer have a limb can experience excruciating pain in a limb that's no longer there. Okay, so coming to the end of my little part here. So the million-dollar question then is, so what now? How do I approach this? I don't know, grizzly bear seems to be a theme in these slides. What feels like a really dangerous, or like a big hairy monster. How do I approach this? Has anybody ever been told to push through the pain? Have you ever been told that? Have you been told that? And what normally happens if you push through the pain? It hurts. It hurts. And it's going to hurt, and you'll probably pay for it. So pushing through the pain, or pushing right past this big hairy monster, is not the answer. And also, so ignoring it is not the answer. So I'm just going to skip ahead here. So how we approach it is very slowly and carefully, mindfully, and one step at a time, so we don't further overload our fight or flight or our central nervous system. But anything that affects our nervous system or changes it, it's possible that we can have an influence to change it back. Okay, so one small step at a time. Is that a question there? Yes.
Do you go into any distinguishing between
seen an injury that's not healed or misdiagnosis, do you go through any communication about anything like that?
That's a really good question.
Pain, like it's healed and you have pain and there's no reason for it, and
Yeah.
other times it's like, oh, that wasn't the right diagnosis, that wasn't the right treatment, or it's never going to heal. Do you go through any communication regarding that?
I think that's actually one of the big questions here. It's always a balance, and we never know for sure. And so that's why we have physicians, that's why we have places to go, because, you know, what if there is a danger and we're not aware of it? And so that's a really valid question. And it's something, until you get to a place where you're feeling pretty confident that there is no danger, then you have to keep going until you have that sense of safety that's the case. Yeah. So absolutely. I mean, sometimes people have surgery and, you know, still nothing. And just because nothing can be found, I suppose, doesn't mean necessarily there's nothing there. We never know. But we do get into the emotional realm, which is we're going to go to that point as well. At what point do you say, okay, I've explored every possible avenue, and it's possible that I'm dealing with an emotional issue here or something else underlying that isn't necessarily physical.
So you could just call it coping with pain, period. Whatever the cause of the pain is?
Yes, and that is what we're going to be talking about. Yes. Thank you. That's a good question. Thanks.
Yeah, thanks. The other thing that it just came to mind, that these tools will help you no matter what, I guess is what you're saying, like coping with pain no matter what. Yeah. Whatever the cause is. Yeah. Okay. So I'm just going to take you through one of the tools that we're going to offer you. And when people first started talking to me, many years ago about using the breath and breath work, I thought, breath, what does that have to do with anything? But I saw time and time again, working with people in pain, just the general population actually, that very few people were actually breathing optimally to their full capacity. And most people had long periods of time, which again makes sense when you're in fight or flight, where they weren't breathing at all. And when we're not breathing, we're restricting our oxygen levels, our muscles tend to get tighter, and we can create, and it's very difficult to relax. In fact, it's impossible. So the antidote to the fight or flight response is something called the relaxation response. And the relaxation response is a calm, relaxed state of your nervous system where your body can actually find some rest, some relaxation, and puts us in a more optimal place for health and healing. And not only that, just within 2, 3, 4 breaths of deep breathing, we can shift our brains from that danger alert part of our brain that causes anxiety into a more relaxed, what they would call rest and digest. So over the course of the 4 weeks, optimal breathing that's actually used now in many ways to treat pain, anxiety, post-traumatic stress, and sometimes even depression. Our optimal breathing is somewhere between 5 to 6 breaths a minute. I found it takes a little while to kind of retrain yourself to get there, but that's about 5 counts in and 5 counts out. So 1 degree course correction, one pathway that we all have if we're sitting here right now is our breath. And that is something you can do anywhere, take it with you, because it's always there. Our breathing is affected by our pain, and our pain is also affected by our breathing. But the one pathway or the one doorway that we have is that we have some control over our breathing. So everybody just take a moment, just as I wrap up, and just if you're holding a pen or a pencil, just put it down. Find your 2 feet flat on the floor if that is comfortable for you. I'm just going to take you through a short exercise right now. So Just sitting as comfortable as you can in this moment. Okay? Perhaps with your back against the chair, you may feel your lower back supported. And you can either lower or close your eyes, whatever most comfortable for you. Relax your arms as best as you can today. And just start by taking a deeper breath in. And a longer exhale out of your mouth. And another deep breath in, even going deeper into your lungs. And a longer exhale out of your mouth. As best you can, let your shoulders relax. Breathe in. And a deeper exhale, longer exhale out. So as best you can, inhale, 2, 3, 4, and exhale, 2, 3, 4, 5. That's it. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5. And inhale, 2, 3, 4. Relax your jaw. Exhale, 2, 3, 4, and 5. And inhale, expanding your lungs front to back as best as you can. And exhale, drop your shoulders, maybe even just a millimeter. And inhale, relax your shoulders, your jaw, and your forehead. And exhale, nice and long. And last one. So inhaling, filling up your lungs, bring oxygen to all the cells of your body. And relax your arms and your legs as you exhale. Let your exhale go all the way out. Okay, so open or raise your eyes. Just take a moment just to check in with yourself, how you feel right now. Sleepy. Anybody find that difficult to do? Okay. It's not always easy to begin with. And you may start out with a count of 2 in and 2 out. And if that's optimal for you, just stay there. So don't worry if you're not able to take a deeper breath, but it gives you a pause. And it also can just bring your fight or flight nervous system from here to here. So I encourage you to, if you're waiting in line or if throughout your day, just to stop and do a couple of expanding breaths throughout your week as a 1-degree course correction. Oh my, I've talked a long time. Yes, question.
This is great.
Mm-hmm.
It works short term.
Mm-hmm.
What's the next step?
Mm-hmm. So, yeah, absolutely. Great question. So this is where we need to start. So in terms of breathing, we would start right here. So that over time, and again, 1 degree, over time, your breath becomes easier, deeper, and you know that when that's happening, that your muscles are becoming more relaxed around the pain, which will hopefully over time help your level of pain. Breathing, I've come to see is essential. Also, if you have any sleep problems, if you have insomnia, you can bring it in then, but it does take practice. It can also help levels of anxiety. It's actually essential if you do suffer with anxiety on top of pain to start here. And we're going to go into more steps.
And just
Yeah.
Yeah, breathing works. Like you can go to your happy place, and then what?
So I think that's, again, to recognize that it's going to be a while before you even notice what the next, have an experience of a change, that we're going to be talking about 1-degree course corrections. And what you'll find over time is you start looking at all the different areas to start focusing on, that you'll start noticing subtle shifts. But I think we're not telling you that we have a magic bullet. We have something that if you do that, then your pain is going to be gone. We're looking at how are you going to find ways to have a slightly better experience in your body with pain. And over time, hopefully that will make a difference to you. Does that make sense?
Yeah.
It would be nice if we could say, if just do X and then just do this, and then you'll be pain-free. We're not talking about that. We're talking about how can we help you to have a better experience and live with pain in a way that allows you to be more functional, be able to move, be able to have a better experience of life than you're having right now. Okay?
Yeah.
So we're going to take a 2-minute break and come back and talk about something a little bit different. Okay, so if you want to come back. So one of the things that we are going to be talking about and I'm hopefully going to keep coming back with is to start to have a different way of looking at things, sort of a different way of thinking. And what I'm going to ask you to do is imagine putting a frame of reference around this entire course. And the frame that I'm going to ask you to use is need. Because what we're looking at, and when I say need, I mean more than just physical needs, although I'm including that in it. What I mean is your physical needs, emotional needs, social, spiritual, all of that. And so if you think about that, it's a different way of sort of understanding the experience that you're having right now. So what I need is what's important to you. And we're going to talk a lot about that because that's what's meaningful, what's important, what are your values. And so in chronic pain, there's a lot of needs that are not met. Anybody think of needs that are not met right now when you're dealing with chronic pain? Social activities, yeah.
Physical activity, whether it's day-to-day stuff or
Yeah,
fun for the body.
yeah. But every aspect of life, exactly. Primary relationship needs energy for relationships, to be able to move without pain and interact with your family. So family, mobility needs, energy. Again, often energy is a need that's not met, right? How about financial? How about work? Concentration when you're experiencing pain. Your need for just sustainability sometimes is some pretty basic need not met. Sleep, we're going to talk about. Exercise, sports, fitness, some people, that's been a huge concept, a huge aspect of their life, and now they feel, if not completely excluded, limited in terms of what they can do. Entertainment, fun, just having the energy to be able to go out and do the kinds of things that you used to always do. So there's many, many needs that are not met when you're experiencing chronic pain. Even just relaxation, recharging. So what I want to talk about is to recognize that every time there's a need that's no longer met, you're dealing with loss. And when there's loss, you have grief. And people often don't understand what grief really is, because grief is actually, it is the body's organic response to loss. And it's much more complex than people often understand. So if you can imagine that every single thing that you do, every strategy that you have is there to meet a need. So we're going to talk about strategies to meet needs, dealing with grief around your quality of life with chronic pain. And so, first of all, I'd like to talk about grief itself. So what is grief? We often think of grief as just sadness, just a feeling. I'm feeling grief, and it is a feeling, but it's not just a feeling. Grief is a really complex reaction or response. And it's a response to losing something or someone that you're attached to, something that's important to you. So right now, the things that we're talking about are things, a lot of things in your life that are really important to you that you're not able to experience in the way that you want to or you have in the past. So if grief is a response to loss, and it's actually a lot of different feelings and thoughts, and that's the other thing to understand about grief. Grief isn't just a feeling, it's also what you think and how it's a cognitive process, how you respond. Mourning is expressing those feelings and those thoughts. And mourning is healing. So think about that. We have all these feelings, all these thoughts about things that we've lost in the context of chronic pain. And healing this is basically mourning it, which is expressing it. So grief can be things like, what am I going to do now that I can't do the same job that I used to do, or I can't do the kinds of things that I want to do. I feel anger, I feel regret, I feel pain, but I feel all these anxiety-producing thoughts as well. So if grief is the result of loss, mourning is its expression, and it's things like, okay, so what do I do now? When will this ever be over? How am I going to manage? All those kinds of thoughts, And where do I go from here? I feel lost, I feel perplexed, I feel confused, I feel bewildered, I feel angry, frustrated. And so one of the main gurus of dealing with grief and loss in the bereavement world is a guy named Ellen McNaughton. And he talks about grief as reconciling to change. Whenever you reconcile to change, you're dealing with loss on some level, even sometimes when it's a seemingly positive change. And a book that I'd actually recommend is Living in the Shadow of the Ghost of Grief, and it's called Step into the Light. And it basically talks about how to deal with losses that we've had throughout our life that are basically not lost. I mean, there's loss due to death, and there's a lot of books and a lot of literature about that kind of bereavement and that kind of grieving. But what's interesting to understand is that we're not socialized to mourn. We're not socialized to really allow ourselves to grieve for losses in our life they seem too trivial, they seem too small to be able to recognize that they are losses. And certainly losses around chronic pain are significant losses. If you think about steam will just dissipate. If you just have steam in a room, it will just kind of disappear. But if you compress steam, it is powerful. It can run a locomotive. You can blow up an apartment building with compressed steam. If you can imagine, feelings are similar. If you have feelings that build up and you don't express them, what happens sooner or later over time, they do express, and they often will express in seemingly negative ways, right? Sometimes we explode with anger or whatever that feeling might happen to be. And then we have the message, oh, that was not good. I shouldn't express how I feel because it's negative when I do that. It's only negative because you took so long to get to the point where you felt that actually the feelings just came out. You didn't even choose to express them. They were just exploded out of you. So if you think about grieving, it's something that is best done if you sort of dose the pain. And I'm talking about emotional pain, but I think this applies across the spectrum. That it's kind of a dynamic balance between giving yourself space and time to really feel and express what's going on, and then to take a break from it. And that's what we teach in bereavement around loss, but I think it's something that applies anywhere where grief is involved. It's a very unique balance for each person of basically learning how to, but there's another catch to it as well, and that is that expressing, there's ways to express that are more beneficial than other ways. So expression is key, but have you ever felt like your expression isn't welcome? Anybody else felt expression not welcome? Yeah, I think that's pretty common. So society's message, often from a very young age, don't cry, right? Don't whine, don't complain. Even the words that are used to describe expression sometimes have a very negative connotation. Buck up, stiff upper lip, you know, be positive. The whole positive thing, you should always be positive. Why are you so negative? What message are you getting? How I feel and what's going on for me, it's not safe to express here. So who I am, to be able to be authentic, it's not okay for me to express that. Just grin and bear it. And the other side of it is, if you want to celebrate, bring it on. I'm happy to celebrate with you. But if you need to grieve, if you're sad, you go grieve, and when you're ready, you come back, right? So what the message there is, grieve in isolation. Go grieve by yourself, which is actually the worst place to grieve, because we are wired for connection. We are people that need connection in order to flourish and thrive in this world. So we need to be able to connect and have people support our expression. So if you've heard any of these messages, it's not surprising that we do keep it in. So if you remember that when that expression of painful feeling is blocked, then the mourning of your grief is actually also blocked. And, pardon?
What does that mean?
It means that basically your healing is blocked. And so what you're going to find is that oftentimes in terms of expression, and you might notice this already, and we're going to talk a lot about, you noticed on the toolbox, there's a whole section on support. And I also, one of the things I work with is communication. And it's really helpful to have a way of connecting with people where you get the kind of support that you're looking for. And I'm sure that maybe most of you have had the experience that, and this happens in bereavement when you're dealing with people who've lost people as well, is that your family and friends, you wear them out because they're sympathetic and they really do care about you. But after you've expressed 4 or 5 times, they're done. And they really don't want to hear it anymore. Pardon?
Because they're mostly sympathetic, not empathetic.
Exactly. And so basically, you might notice that people will emerge in your life who maybe have had a similar experience. In fact, you might notice people in this room might be able to relate to your experience better than people that you have in your life. And so I think one of the things to recognize is it's important to have support, and you might need to look at support in a different way. And next week we're going to talk about a process where I'm going to talk about how to support yourself and how to get deep, profound empathy yourself and start to recognize your own self-talk. Because we talk about our thoughts and what we're saying to ourselves, and sometimes we're not on our own side. We're almost our own worst enemy because of some of the things that we're saying to ourselves. And so what we're going to talk about in these 4 weeks is finding ways to get the kind of support that you need from the people in your world and find other people. So there's ways to ask for the same thing that are easier to hear when you start getting clarity, and to recognize that sometimes a 1-degree course correction is just an insight. It's just an awareness. It's just recognizing and seeing things in a slightly different way. And all of a sudden, as your perspective shifts and your perception of your reality shifts, your experience of that reality also shifts. Okay? Yes?
One of the big things that I want
how to express your feelings. And you're saying that you really need to find support. I don't want support. I don't want to tell anybody. I want to be able to hear myself.
Yes.
And you know,
You need to come next week for sure, because I'm going to talk very specifically about that.
I want to be in person. I don't want to be in person telling you. It's like when I share with people, they don't want to hear it. You don't want to tell them.
Yes. Well, and the other thing too is to understand, and remember I told you that I want you to frame this course in need. Because I'm telling you, you need to express, and I'm very sure that I do want you just to express. However, if you just express, you can actually spiral into depression. You can spiral, and you can end up venting. I'm sure that all of you have had the experience of people expressing, and it was a very negative experience for themselves and for other people as well. So there is a way to express when that doesn't happen. And the way you do that is you recognize feelings as kind of signposts that point you in the direction of your needs and what's important to you. And when you connect to needs, what you'll find is you'll have a different experience of what you're feeling and how to express that. So we're going to talk a lot about that. But one of the things just to be aware of is that we have way more agency. What that means is just we have way more ability to have a positive effect on ourselves than we really understand. We have choices that we're not socialized to recognize, and we're going to talk a lot about that in the weeks to come. So, you know, communication is important between people, but it's really important to notice the communication that's going on in your own mind. And what you'll find is that as you start supporting yourself, your world becomes more supportive as well. So we're going to talk about recognizing ways of, you know, connecting with people and getting the kind of support that you need. And you don't have to bare your soul, actually. So it's a very good question. So like we're just mentioning, I mean, social support, it's not always positive and it's not always helpful, right? So we say we want support, but sometimes the support that we actually have in our world isn't that supportive. And so we just said, well, yes, we have the, you know, sometimes, have you ever had the experience that you try to get support from people and at the end of it you actually feel worse? Yeah?
Question.
So, a question?
I don't really know how to frame that as questions, but
Yep.
I just had a couple thoughts that I really resonated, that I realized in my life that people's response is not always personal.
Yes.
So people are people, like, so for me to deal with someone in pain, as much as they need my help, I'm a human being that I can only do so much. So I really try to communicate that. I really try to encourage people around me to communicate that. I know that you have this need and this need is valid, but this is my ability, or I don't have.
And you don't have a responsibility to meet another person's need, and that's
It's really important to acknowledge a person's
Yes.
need, and it's really important.
excellent point. And that's a big difference between acknowledging and recognizing and feeling that responsibility to meet it.
And giving that to yourself if someone else is recognizing like,
Exactly.
I just don't have that ability.
You are way ahead of me.
I just didn't know, everybody's experience.
Yeah.
That just really resonated.
Yeah. So a 1-degree course correction, okay?
So what you're talking about here is acceptance of things you can do and you can't do.
Yes.
How does that work when, if you have to accept something that you can no longer do it, where's the drive to be able to go out and actually change and do it again? Because if I follow what you're talking about here, I'd still be in a wheelchair.
So in other words, if you want to have hope that you can continue to do something, again, it's that balance, and that's where you might need support. What's that?
Where's the fight to get it back?
Yeah. Well, and that's the thing that you're always deciding. We're always at that moment of choice. It's like, are you going to push through pain, or are you going to try to? It doesn't. Sometimes you can have an intention of somewhere you want to be. Okay, this is how I look at it, and there's essence and form. The essence is that need. It's in terms of whatever it is, that drive, that wherever you want to go. What's the essence of that? Is it an essence of being able to support yourself or be able to do a particular thing? Or, you know, if you can get clarity about what is the essence, then there's forms that will take you to that essence. And when you get to the essence, what you'll notice is the universe opens. There's so many different ways to get to the same place. And what happens often is we get attached to the form. We get attached to the strategy. So, for example, if the essence is you want to be able to support yourself with productive work, and you decide that the only way you can do that is to do a particular kind of work, like maybe drive a truck or do something in particular, then if that it isn't available, or in that moment isn't available, then you're really stuck. But if you recognize that, okay, to get to that place that you want to get to, what's the experience that you want to have by going for it and by doing, like not wanting to be in a wheelchair, you want agency, you want to be able to have that sense of being able to independence. Okay, so if you, and independence, again, when you talk about just a shift in perception, we're all sort of interdependent, but the independence of being able to walk and not be in a wheelchair. So there's probably many, many different ways to get to that place. And for you, then the choice is, how do I get there?
Yes, if I was gone and said, no, I can't do that.
So you can mourn that you don't, yeah, you can mourn that you don't have it.
And try to find the other path to get there.
I think, first of all, just to recognize, and that's where I think it's interesting that you said independence, because we're all interdependent, and that's what we're talking about, support. You might need support to have the experience that you want to have, doing that thing that you want to do. Does that make sense? That's something I think we could probably talk more about, but I think you sort of get my drift. Yeah. Anyway, in terms of a 1-degree course correction, and again, you've got your sheet there, you know, it's something you might want to talk about, and I just mentioned again, it can be so subtle. It can be something like just seeing something in a different way, having a different awareness. But you'll probably notice that there's certain people that are more comfortable to be around. There's certain people who kind of get you. I think most of us, if you look at your whole support system, if you look at the people in your world, there's people who get you. And you know what? They get you no matter what. You can be crying one minute, laughing the next minute, and they're okay with who you are as an authentic person. There's people who almost get you. Like, they're not, you know, they don't always get you, but with a little bit of help, they get you. And then there's people who, you know what, in this lifetime, they will never get you. Can anybody relate to people like that in your life that, you know what, they don't get you? It doesn't mean that you don't ever spend time with them. What it means is that when you're feeling vulnerable, you can choose not to spend time with them. And you can, and I would invite you to think about spending much more time with people who get you or almost get you, because how that affects your quality of experience and how you feel in the world makes a huge difference on the whole organism. And like Madeleine was saying, everything is connected to everything else. So your whole life doesn't go on hold while you're dealing with chronic pain. So if you can have an experience where you spend time with people that you feel like you can be authentic, that you can just, it's not that you want to have a laundry list of, you know, telling people everything that's going on with you, but you can be real. You're going to find a level of relaxation, a level of just feeling like you can accept yourself because you're in a space where you're accepted. That could be a 1-degree course correction. A 1-degree course correction is just looking at your circle of friends and thinking about, who are the people that I feel more comfortable with? Because sometimes we don't think about that. So I would invite you to think about, take stock of your support network. Who in your world gives you support, and what kind of support do they give you? Invite people to this class if you think it's helpful. If people might learn things because sometimes people just say the wrong thing. Their intention is wonderful, but what they say is really counterproductive because they don't have information. So sometimes it's a choice of finding ways to give people information in your world. Talk to them about chronic pain, about grief, about the things that you're learning. Learn to say no. Sometimes that can be a 1-degree course correction. Recognizing that we have more choice than we often realize that we do. And when you're doing things out of obligation, guess what? You're tense, you're tight, you're in pain. So it's a vicious circle going in that negative direction. So start to recognize and start to cultivate the things that bring you peace, that are things that are comforting to you in all aspects, not just physically, because your emotion is so connected to the rest of your experience of life. And it's amazing how when you start in one section having a positive experience, it makes a difference in the rest. So we're going to talk a lot about learning to support yourself. And then you're going to have a 2-minute break. Oh, we're almost at 2:25. Okay, are there any questions? We have a physician here. We have, we've had some discussion about, is there anybody that has, yes?
I agree with inviting your support when we like to do this class. Sometimes that's not realistic.
Mm-hmm. Yeah. Right.
How do you talk about finding people you can communicate with and comfortable with, but how do you not emotionally exhaust the people in your life?
Mm-hmm.
My partner already has to step up more physically and do a lot more physically. He watches me in pain. And I agree that wanting support and being able to acknowledge that. But how do you do that when you're living with someone, if you're with someone all the time? How do you not totally burden them?
Mm-hmm.
That's something that I personally struggle with.
Well, again, it depends on your own energy level, but I would say don't try to get all your needs met in one place, because in a sense, he's a strategy for you to meet those needs and to recognize there's many, many more strategies. So the more, even if you find one other person or a group, and again, it doesn't have to be ultimately it'd be wonderful to have a chronic pain support group. Again, I think that should be probably a group that's facilitated, because it could, there's kind of that balance between people expressing too much and, but a book club or something else that, again, as time permits, other ways for you to meet needs so that you're not having all your needs met in one place can be helpful.
I think it'd be more about expressing the pain, when it's 8 o'clock at night, and sometimes I can barely walk to the bathroom. I'm just wondering how you can express that. I don't know whether you have. I'm sure you'll get into it a bit more as go on, but when we live with people, I find that I'm hiding pain a lot, and I'm covering it up. It's like steam and then it explodes.
Mm-hmm.
I'm just wondering if how to just.
Well, and I think and I think it's going to be unique for each person, and it's going to be every lock has a sort of a different key. So depending on your personality, depending on your partner's personality, depending on other things that happen, and again, it's trial and error. You're going to try things and they're going to work, and other things and they're not going to work. But sometimes just talking about it and even just expressing just what you expressed, I really don't want to overburden you. I feel like I know I need to express, but I'm not sure how to do that, so that at least you're on the same page. Communication is very, very important. And next week we're going to talk about difficult emotions and communication and self-support. So, but again, there's just so much, and we're just kind of on we have to just start in one place. I mean, just the information we had about the difference between chronic pain and acute pain, just understanding that, it can be a 1-degree course correction. So when you have something that's overwhelming, it's not surprising that you're saying, okay, I want all of it now. But we can only give you a little bit and a little bit and a little bit, and then hopefully you're going to look back and say, wow, look, I've had a bit of a shift here. And you start to notice. Yes?
I have 2 questions. Could you also call grief, like letting go? Like whether you're letting go of your ability, the ability that you lost, you could be letting go of.
Letting go is definitely.
The negative, whatever it is, whether you're you're not losing hope, like you're letting go of the trauma, or you're letting go of the doctor saying you're never going to walk in shoes. To let go of that. And
letting go is part of grief. It's not all of it, but it's definitely, sometimes it's, recognizing, and again, the whole mindfulness thing, in this moment, this is where I am.
Call will be disconnected.
And we're done.